Sociopathy versus psychopathy. What's the difference? Psychopathy and sociopathy, two terms often intertwined in common parlance, in fact, encapsulate separate dimensions within the intricate landscape of antisocial personality disorder, ASPD. ASPD, an enigmatic and multifaceted condition, serves as the canvas upon which these divergent personalities are painted, unified by a shared deficiency in empathy and a penchant for flouting societal conventions. Our journey into this complex realm embarks upon a quest to unravel the profound disparities that delineate psychopathy from sociopathy, transcending mere diagnostic labels to delve into the origins and expressions of these personality disorders. ASPD, a condition at the heart of this exploration, presents a tapestry of traits characterized by an emotional void and an unapologetic disregard for established norms and regulations. Yet, it is within the microcosm of psychopathy and sociopathy that we unearth a universe of distinctions that defy the conventional wisdom of lumping them together. The diagnostic criteria that form the bedrock of these disorders serve as our starting point, but the divergence does not stop there. The unique emotional dynamics, behavioral patterns, and even the roots from which these disorders spring are all part of the intricate mosaic that distinguishes psychopathy from sociopathy. Our understanding of these differences is pivotal, for it is through this nuanced comprehension that we unlock the potential to identify and confront these personality disorders with precision and efficacy. To delve into this realm is to equip ourselves with the knowledge necessary to navigate the complexities of psychopathy and sociopathy, allowing us to foster a more empathetic and informed society where those in need can receive the help and support they require. Diagnosis and terminology. In the realm of psychology, a consensus exists among experts that both psychopathy and sociopathy are encompassed by the broader category of antisocial personality disorder, ASPD. At its core, ASPD is a complex condition marked by an enduring disregard for the emotions and rights of others, frequently culminating in actions that inflict harm upon individuals and society as a whole. It is, however, crucial to dispel a common misconception. Within the context of ASPD, antisocial does not allude to introverted tendencies or a preference for solitude. Instead, it emphatically underscores behaviors that undermine the fabric of society itself. What further complicates the understanding of these personality disorders is that they share identical diagnostic criteria. This uniformity in diagnostic guidelines presents a formidable challenge when attempting to differentiate between psychopathy and sociopathy solely through diagnosis. While both conditions fall under the same ASPD umbrella, it is the nuanced nuances that set them apart, revealing their distinct personalities and behavioral traits. To unravel these intricate differences and gain a deeper understanding of these enigmatic disorders, we must embark on an exploration of their unique emotional dynamics, behavioral patterns, origins, and emotional capacities. Only by peeling back these layers can we truly appreciate the intricate tapestry that is psychopathy and sociopathy, each with its own complex narrative and impact on the lives of those who grapple with these conditions. Emotional masking and relationships. A pivotal contrast emerges in the realm of interpersonal interactions. Sociopaths embrace a disconcerting transparency regarding their dearth of empathy and their utter disregard for the needs of others. This unapologetic candor often begets tumultuous and abusive relationships, leaving a trail of emotional wreckage in their wake. In stark contrast, psychopaths are virtuosos in the art of concealing their true emotions and intentions, crafting an illusion of normalcy that seamlessly integrates them into social circles. This uncanny ability allows them to establish enduring relationships and even families, often ensnaring their loved ones in a web of deception without a hint of suspicion. Their charisma and mastery of emotional mimicry can be riveting, drawing individuals into their orbit, blissfully unaware of the darkness lurking beneath the facade. It is in this stark divergence of social adeptness that the true intricacies of these personality disorders come to the fore. While sociopaths wield their blatant indifference as a weapon, leaving chaos in their wake, psychopaths employ a subtler, more insidious form of manipulation, ensnaring those around them in an intricate web of deception and emotional mimicry. Understanding these differences is pivotal in identifying and responding to individuals with psychopathy and sociopathy, as it reveals the multifaceted nature of these disorders and their profound impact on the lives of those who encounter them. Impulsivity versus methodical behavior. Another pivotal divergence surfaces in the realm of behavioral patterns. Sociopaths exhibit a propensity for impulsivity, frequently succumbing to explosive outbursts of aggression. Their violent acts and criminal deeds tend to unfold with rapidity and often transpire in the heat of the moment, fueled by unchecked emotions. Conversely, psychopaths are renowned for their methodical and calculated approach to their malevolent intentions. They are architects of elaborate schemes, orchestrating heinous acts with meticulous precision in a chilling detachment from moral constraints. This stark contrast in behavioral styles sets psychopaths apart, making them considerably more challenging to detect compared to their more overt sociopathic counterparts. The distinctive modus operandi of these two personality disorders underscores the complexity of their pathology. While sociopaths leave a trail of impulsive and explosive actions in their wake, psychopaths operate stealthily, navigating the shadows with cunning and premeditation. Understanding these behavioral disparities is instrumental in identifying and addressing psychopathy and sociopathy, as it unveils the intricate layers of these disorders and the unique challenges they pose for both individuals and society at large. Nature versus nurture. The age-old debate of nature versus nurture casts a revealing light on the origins of psychopathy and sociopathy. Sociopathy is frequently attributed to environmental influences, portraying it as primarily a learned behavior that takes root in the aftermath of traumatic experiences and childhood neglect. In this view, sociopaths are shaped by their surroundings, their personalities sculpted by the harsh landscapes of their early lives. Conversely, psychopathy is often portrayed as possessing a more potent genetic underpinning, with environmental factors playing a diminished role. Here, the belief is that psychopaths are born, not made, their predisposition toward callousness and manipulative tendencies rooted in their genetic makeup. While both conditions ultimately fall within the ASPD spectrum, the contrasting etiologies underscore the profound divergence in their underlying causes. The nature versus nurture debate beckons us to explore the intricate interplay between genetics and environment, leaving us with tantalizing questions about the formation of these enigmatic personality disorders. How much of our behavioral traits is hard-coded in our genes, and how much is shaped by the crucible of our upbringing? This ongoing debate challenges us to unravel the complex tapestry of psychopathy and sociopathy, shedding light on the multifaceted nature of these conditions and offering new perspectives on their origins and development. Empathy and emotional stability. The capacity for empathy serves as another fundamental point of differentiation between psychopathy and sociopathy, unveiling their unique emotional landscapes. Certain psychologists posit that sociopaths might retain a semblance of empathy in specific situations, although its manifestation remains inconsistent and feeble. Their moral compass, while weak, might still occasionally guide them towards a rudimentary sense of right and wrong. In stark contrast, psychopaths inhabit an emotional realm characterized by an unsettling void of empathy, irrespective of the circumstances. Within this psychological terrain, the concept of right and wrong is virtually non-existent. What sets psychopaths apart is their remarkable mastery over emotional control, creating an intricate facade that obscures their true nature. The contrasting degrees of empathy and emotional regulation between these two personality disorders constitute a complex psychological puzzle. While sociopaths teeter on the fringes of empathy, with occasional glimpses of a faltering moral compass, psychopaths inhabit an emotional abyss devoid of any empathic response. This divergence poses a significant challenge in identifying and comprehending the behaviors and motivations of individuals with psychopathy and sociopathy, underscoring the intricate nature of these enigmatic conditions and the profound impact they wield on their own lives and the lives of those around them. In summary, the world of psychology unravels an intriguing narrative of psychopathy and sociopathy, two distinct personality disorders that, despite sharing a common origin under the banner of ASPD, are worlds apart in their essence. These disparities span the spectrum from their diagnostic criteria to their behavioral patterns, origins, and emotional landscapes. Recognizing these profound distinctions is a linchpin for effective diagnosis and, subsequently, tailored treatment approaches. Crucially, Acknowledging that individuals grappling with ASPD can receive treatment and support is paramount. This realization holds the promise of rehabilitation and the potential to curtail the harm inflicted upon society by these conditions. Shedding light on the intricate web of psychopathy and sociopathy is a pivotal step in this journey, one that propels us toward enhanced identification and more effective intervention. In the grand tapestry of our collective understanding, comprehending these complex disorders fosters the prospect of a safer and more empathetic society. It empowers us to extend a compassionate hand to those ensnared by the enigmatic grip of psychopathy and sociopathy, offering them hope, healing, and the chance to rewrite their narratives. Ultimately, this pursuit of knowledge propels us toward a world where empathy triumphs over apathy, understanding triumphs over ignorance, and healing triumphs over harm.